Crestor is not for everyone, including people with liver disease. And women who are nursing, pregnant, or may become pregnant. Simple blood tests are needed to check for liver problems. Tell your doctor about other medications you're taking, or if you experience muscle pain or weakness, because there may be a sign of serious side effects.
Disorders of the esophagus, are unable to stand or sit upright for 30 minutes, have severe kidney disease or low blood calcium. Use with caution if you have stomach or digestive problems. Stop taking Fosamax and tell your doctor if you develop new or worsening heartburn, difficult or painful swallowing, or chest pain, because these may be signs of serious upper digestive problems.
May increase the chance of heart attack or stroke, which can lead to death. This chance increases if you have heart disease or risk factors for it, such as high blood pressure or when NSAIDs are taken for long periods. All NSAIDs, including Celebrex, also increase the chance of serious skin reactions or stomach and intestine problems, such as bleeding and ulcers, which can occur without warning and may cause death. With any of these medicines, patients also taking aspirin in the elderly are at increased risk for stomach bleeding.
Dry mouth, insomnia, sexual side effects,
some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Chantix. If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away. Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people can have allergic or serious skin reactions to Chantix, some of which can be life-threatening. If you notice swelling of face, mouth, throat, or a rash, stop taking Chantix and see your doctor right away. Tell your doctor which medicines you're taking, as they may work differently when you quit smoking. Chantix dosing may be different if you have kidney problems. The most common side effect is nausea. Patients also reported trouble sleeping and vivid, unusual,
or fall asleep during normal activities such as driving, or to feel faint or dizzy when you stand up. Tell your doctor if you experience these problems, if you drink alcohol, are taking medicines that make you drowsy, or if you experience increased gambling, sexual, or other intense urges. Other side effects include nausea.
May cause an unsafe drop in blood pressure. Side effects may include headache, flushing, upset stomach, and abnormal vision. To avoid long-term injury, seek immediate medical help for an erection lasting more than 4 hours. Stop taking Viagra and call your doctor right away if you experience a sudden decrease or loss.
That may cause you to fall asleep or feel very sleepy during normal activities such as driving, or to faint or feel dizzy when you stand up. Tell your doctor if you experience these problems, or if you drink alcohol or are taking medicines that make you drowsy. Side effects include nausea, drowsiness, vomiting, and dizziness, especially if you've had a stroke.
If you develop fever, unexplained weakness, or confusion, tell your doctor promptly, as these may be signs of a rare but potentially life-threatening condition called TTP, which has been reported rarely.
Serious stomach problems such as bleeding can occur without warning. Tell your doctor if you have
liver problems, are nursing or pregnant or may become pregnant. Your doctor will decide if Zetia is right for you. Unexplained muscle pain or weakness could be a sign of a rare but serious side effect and should be reported to a doctor right away. Common side effects include
don't drive or operate machinery, sleepwalking and eating or driving while not fully awake with memory loss for the event, as well as abnormal behaviors such as being more outgoing or aggressive than normal, confusion, agitation, and hallucinations may occur. Don't take it with alcohol, as it may increase these behaviors. Allergic reactions such as shortness of breath, swelling of your tongue or throat may occur and in rare cases may be fatal. Side effects may include next-day drowsiness, dizziness, and headache. In patients with depression, worsening of depression, including risk of suicide, may occur. If you experience any of these behaviors or reactions,
including people with liver problems and women who are nursing, pregnant, or may become pregnant. You need simple blood tests to check for liver problems. Tell your doctor if you're taking other medications or if you have any muscle pain or weakness. This may be a sign of a rare but serious side effect.
You have unusual changes in behavior or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thyroidazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing of the skin or eyes. Talk with your doctor about your medicines, including those for migraine, or if you have high fever, confusion, and stiff muscles, to address a possible life-threatening condition. Tell your doctor about alcohol use, liver disease, and before you reduce or stop taking Cymbalta. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation.
Allergic reaction, a severe rash, or signs of unusual behavior, stop taking Tamiflu and call your doctor immediately. Children and adolescents in particular may be at an increased risk of seizures, confusion, or abnormal behavior. The most common side effects are mild to moderate
Don't
nausea and
drive or
vomiting.
operate machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. In depressed patients, worsening of depression, including risk of suicide, may occur. Alcohol may increase these risks. Allergic reactions such as tongue or throat swelling occur rarely and may be fatal. Side effects may include unpleasant taste, headache, dizziness, and morning drowsiness.
Which can make some heart problems worse or lead to heart failure. Avandia is not right for everyone. Talk to your doctor if you have heart failure or liver problems. Blood tests should be used to check for liver problems before starting and while taking Avandia. Avandia may cause weight gain. It may cause low blood sugar when taken with other diabetes medicines and may increase your risk of pregnancy.
Liver or adrenal disease because this could cause serious heart and health problems. Tell your doctor if you're on daily long-term treatment for a chronic condition like cardiovascular disease or chronic inflammatory disease. The pill does not protect against HIV or STDs. Serious risks include blood clots, stroke, and heart attack, so women, especially over 35, shouldn't smoke because it increases
blood clot, stroke, and heart attack. Smoking increases these risks, especially if you're over 35. If you've had any of these conditions, certain cancers
have an increased risk of death or stroke. Call your doctor if you have high fever, stiff muscles, and confusion to address a possible life-threatening condition, or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Abilify and medicines like it. In some cases, extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be serious, dizziness upon standing, seizures, trouble swallowing, and impaired judgment.
Infections, including tuberculosis. Serious, sometimes fatal events can occur, such as infections, lymphoma, or other types of cancer. Blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure. Before starting Humira, your doctor should test you for TB. Ask your doctor if you live or have been to a region where certain fungal infections are common. Tell your doctor if you have had TB, hepatitis B, are prone to infections, or have symptoms such as fever, fatigue, cough, or sores.
Sites between these products differ. Women and children should avoid contact with application sites. Discontinue Androgel and call your doctor if you see unexpected signs of early puberty in a child or signs in a woman which may include changes in body hair or a large increase in acne possibly due to accidental exposure. Men with breast cancer or who have or might have prostate cancer and women who are or may become pregnant or are breastfeeding should not use Androgel. Serious side effects include worsening of enlarged prostate, possible increased risk of prostate cancer, lower sperm count, swelling of ankles, feet, or body, enlarged or painful breasts, problems breathing during sleep, and blood clots in the legs. Tell your doctor about your...
And heart-related deaths were seen in studies. It's not certain Uloric caused them. Certain tests to check liver function may be required. Tell your doctor about liver or kidney problems or history of heart disease or stroke. The most common side effects are liver problems, nausea...
If you experience a serious allergic reaction, severe abdominal pain, or become constipated for 3 or more days, tell your doctor right away. Common side effects are dry mouth, constipation, blurred vision, and indigestion.